Each year, millions of adults in the U.S. are diagnosed with vascular disease. And it's no wonder. With over 60,000 miles of intricate arteries and veins throughout the human body, there are bound to be complications due to blockages, weakening of the blood vessel wall, and other issues impacting the circulatory system. With an aging population and the growing incidence of risk factors such as diabetes, high blood pressure, obesity, smoking, and the disproportionate incidence of vascular disease in our minority populations, the management of vascular health is becoming a key focus among today's healthcare leaders and providers. As with any medical disease or condition, it takes an entire team of dedicated professionals to find new ways to efficiently diagnose and treat patients, as well as to improve their long-term care. In vascular health, the leader of the team is today's vascular surgeon. Only vascular surgeons dedicate their entire training and practice to address the full spectrum of vascular health, as well as provide comprehensive care that includes preventive, medical, surgical, and minimally invasive solutions. Through ongoing education and research, as well as pioneering new techniques, vascular surgeons are on the leading edge of clinical breakthroughs that are transforming vascular health. As part of their comprehensive approach, vascular surgeons partner with other healthcare professionals to provide quality care tailored to each patient. This patient-centered model is vital to help all physicians manage vascular health in at-risk populations and promote healthier lifestyles in the future. Vascular surgeons are involved in every part of the disease process, from making the diagnosis to the management of disease. Vascular surgeons are comprehensive leaders in vascular health. Today's vascular surgeons are creating a new chapter in the vascular health story with improved patient care, better outcomes, collaboration, and leadership. Surgery is only part of our story.
Welcome to our live webcast, the SVS Branding Toolkit, How I Do It. Thank you for joining us. My name is Kai Taylor, and I will be the operator for the presentation today. Before we get started, I would like to take a moment to acquaint you with a few features of this web event technology. At any time, you may adjust your audio using any computer volume settings that you may have. On the right-hand side of your screen, you will see the chat and Q&A window. Please note, if you don't see the chat or Q&A windows, make sure that you are not in full screen mode. In the Q&A area, there is a large window which holds all of your sent messages and a smaller text box at the top where you will type in your questions for the panelists. To send a question, click in the text box and type your text. When finished, click the Ask button. The chat feature is for audience discussion only, so if you want your questions answered by the panelists, please submit them through the Q&A. We are joined today by Dr. Kim Hodgson, immediate past president of the SVS. At this time, I would like to turn the microphone over to Dr. Hodgson for opening remarks and panelist introductions.
Good evening, everybody, and welcome to another SVS Town Hall. Tonight devoted to the SVS Branding Toolkit and how SVS members have been putting this to use in their practice. I'm joined today by my co-moderator, Dr. Joseph Mills. Dr. Mills is a distinguished fellow of the Society for Vascular Surgery and professor-in-chief of the Division of Vascular Surgery and Endovascular Therapy at the Michael E. DeBakey Department of Surgery, Baylor College of Medicine. And before I go on to introduce the rest of tonight's panel, on behalf of Dr. Mills and myself, and in recognition of yesterday's National Women Physicians Day, we'd like to give a shout out to all of the women in vascular surgery, making great contributions every day to our specialty and our patients. In fact, we're fortunate to have several such women with us on our panel tonight, including our first panelist, Dr. Catherine E. Bowser, who's a vascular surgeon at Christiana Care Vascular Specialists in Newark, Delaware. We're also joined by Mr. Mike Chapman, who's the Vice President of Springboard Brand and Creative Strategy. They are the branding corporation that we've been working with at the SVS to put all of these toolkit items together. Our next panelist, Dr. Judith Lin, is Professor-in-Chief of Vascular Surgery at Michigan State University College of Human Medicine. She's also chair of our new Health IT Committee, serving as chair of the task force and now moving on to be chair of that as a committee. Another panelist, Lindsay Gluff-Mager, is the Marketing and Promotion Specialist and Surgical Educator at Michigan State University, works with Dr. Lynn as well, and going to be showing you what good teamwork they've got going there. And lastly, we're joined by Dr. Will Schutz, who's a distinguished fellow of the Society for Vascular Surgery, also serves on the Society for Vascular Surgery's executive board and has for a number of years. He's a vascular surgeon with Texas Vascular Associates in Plano, Texas. So with those formal introductions being done, before I turn this over to my co-moderator, Joe Mills, let me just remind you that if you have questions you would like the panel to address, please use the audience Q&A function. We'll be looking through those and trying to pick out the best to challenge our panelists here. So with all that being said, I'm going to stop sharing my screen and I'm going to turn it over to my co-moderator, Dr. Joe Mills. Joe?
Well, welcome everybody. It's good to be here with you. And I'm going to just give a brief introduction. We had one previous town hall, which kind of introduced the branding initiative. And today we want to get more into the nuts and bolts of how would you use it, because we've tried to make a user-friendly format for our membership. And we've got some guests that are sort of alpha adopters of this, so I'm not going to steal their thunder, but just to run through things pretty briefly. The Public and Professional Outreach Committee was the group that was responsible for this work, and I have their names all listed here. I won't read them to you, but the individuals in blue were part of a special subcommittee that helped us try to get out the first modules that we're going to show you and show you how to use them. I'd also like to thank William Schutze and Tom Forbes, who aren't on this committee, but in their roles on the SVS Guidelines Committee and CPC, they helped us with some of the modules. So I want to give them a shout out because this was a group effort. So as you may remember, 3 years ago, both from SVS leadership and from the membership itself, from polls, decided that the #1 initiative for the society was branding. So we've organized the PPO to try to do this. And what is branding? It's trying to increase the knowledge of what vascular surgeons do and what vascular healthcare is to all different audiences, and to elevate the perception and value of the specialty. Basically to brand ourselves for who we are and what we do. So I won't go through all the preliminaries to this, but basically what we found when we surveyed different audiences was our general perception of us was that we were highly technical, gifted surgeons relied upon for episodic interventions, emergencies. And the perception we had of ourselves was that we provided comprehensive vascular care. And that's the message we wanted to relay to everyone that we want to brand. And so if we want to do that, we need to change the perception, because there is some reality to perception. So you have to become what you want to brand, and you have to be what you want to brand. So that we had a lot of discussions among the PPO, got different inputs from different members, worked with Springboard really closely. And we came down to the message that what we wanted to brand was basically two things. One was that we were comprehensive. And by that, we mean we evaluate patients with the full spectrum of vascular disease. We understand the diagnostic testing involved. We know the best medical therapy. We do endovascular therapy. And we also do open surgery. We didn't want to lose that critical part of what we do, because that's a key differentiator. And that's where we came up with the fairly popular line, surgery is only part of our story. So that brands us as surgeons, but it also emphasizes the fact that we're surgeons and much more. And so a lot of these pictures were taken in Chicago for convenience, but since then we've got a large number of pictures which have been sent from different members. And so how do you do these? So what we've done so far, and the people that are on the panel, and Mike Chapman's going to run through exactly how you do this, but there's now 50 pieces of referral focused content, which consists of videos, at least one of the videos you saw at the start of this session. And there's also snippets of videos that emphasize what we think are key concepts to brand what we are. And these can be used individually in your practice. They can be used on social media. And we so far have come up with 3 condition specific flyers. And when we have time of the discussion, I won't cover that here. We'll run through how they were structured and why they were structured that way. And the next group is going to roll out in the next few months to include other conditions. And you can use these and use them in your practice. So you don't need design skills. It's all been vetted through the PPO, through the SVS leadership, through the guidelines committee, through the clinical practice committee. And you can basically take these and use them to brand your story. So we did this. This is just some work we did this week. My division manager and I did some work with Mike Chapton, and then we took a couple of these and we put pictures from our own practice, our Save the Extremity program. It just shows you how easy it is. We did this in one afternoon to use the materials that we've provided so far in your own practice. So the final thing I'll leave you with is if you're feeling competitive or just frisky, there'll be an announcement soon in the spring for a tool contest. So there'll be prizes of some sort that will be awarded at VAM to kind of look at innovative ways that you can use branding. What did you do in your group? How did you use things? Think of some different ideas. And in addition, if we don't cover it, I do want feedback. So if you start using the tools and you find things that are difficult or ideas you have that would make them better, I can't promise you they're all doable because you have to work within a certain format, but we'll certainly listen to you and try to make the product even better. But I think we're off to a good start. And with that, I will stop sharing my screen and turn it over. Are you going to introduce each person or do you want me to, Kim? You're muted.
All right, that's good. No, Joe, you can do the colorful introductions of the panels. That'd be great.
So they won't be that colorful, but I'll go in. We decided to go in alphabetical order. So our first speaker is from the Christiana Healthcare System in Delaware. I believe she trained in vascular surgery in Colorado. If you're on Twitter, she's a really good spokesperson for vascular surgery, for women in vascular surgery. She's got a unique perspective and brands her individual practice, brands her group, and I think does a superb job of trying to welcome women into our specialty. So Kate's going to lead us off and talk about some things she's done to use these tools in her own individual practice and setting. So Kate, welcome and thank you.
Thank you. So let me bring these up. And so I am hospital employed. We're a large hospital system and we're academic affiliated. I joined about 2.5 years ago. I had done my general surgery training there as well, but I had to be reintroduced as a vascular specialist in a hospital where there were 7 other vascular surgeons at the time, and 6 of them had been there for over 16 years and much, much longer than that. Around the same time, there was a shift towards more of the physicians, the cardiologists, the primary care doctors also becoming hospital employed. And we were also in this heart and vascular service line. All this was happening at the same time. So, even though academically we were under the Department of Surgery, otherwise we were along with cardiology and cardiothoracic surgery, but we never quite fit well in either realm. And that became even more evident as I was pushing to market myself, working with the marketing teams. So I quickly came to realize that a lot of people did not understand what the modern vascular surgeon actually did. Not only patients and marketing, but also just other physicians, leadership, referring doctors, other surgeons, and residents and physician extenders. So it became pretty important to me to do this. And I think it just happened to coincide with your branding efforts because it was around the same time. But the challenges that I faced in a big hospital like this, it took so much time to even get the basic marketing items. And even still, it takes months to work with the team to get something off the ground. The more I pushed for things, the more I realized this confusion because they were trying to fit me into the cardiologist mold with their brochures and pamphlets. And so I had to do a lot of correcting with the marketing. I was included in these confusing campaigns where I was marketed as a women's heart health expert. They misquoted me. I had to rewrite everything. They had me down as an interventional radiologist. So these are the kind of things that I deal with. And I was trying to always steer it back to, okay, what does a vascular surgeon have to offer? But what I missed was that actually at the bottom of that ad, the number all went to cardiology. It was not our office number. So it's just those little things. It's a lot of extra work. And then when they did get the number right, they ended it with "trust your heart" to Dr. Bowser. And I just found that to be so confusing. Anyway, I'm very passionate, as we all are, about our specialty. And I wanted to just see what I could do in my own community. And for me, that started with social media. And I have a lot of friends who are physicians and in the healthcare field. And so that's really how I started becoming active. And I wanted to showcase our residency and our residents, because they're always doing some really, really neat stuff with us. So, going with social media, with Twitter, Med Twitter, was really useful because of all the other, physicians in all different fields, and helping them to understand what vascular surgery was like. But it also led to me expanding my network and making great connections with other vascular surgeons. And with the pandemic, social media engagement did increase across the board. At the same time, I wanted to consolidate my online presence. And so I started a website, and I realized, we have these marketing tools. I can see how I can use that and maybe expand this to educating not only the marketing staff or the staff in our office and my patients. So I used the branding tools, and I shared the video on Twitter. This is it on Facebook, and see if it'll let me go by quickly. I know that we're going to go into detail with this a little later, but it's just so easy. After you log in, this is just how you just find the web content and the branding downloads. And I was able to place on my website this already written content off of a Word document that you download. And then that's it. And then I was able to use this text, which I then fit to be more readable on a website, but it was essentially the same content. So this is my website, and I just quickly show you. Make sure I didn't miss anything. I have the video on the main page. And then I go into what is vascular surgery. I have a separate page where I go in a little more detail after, you could see the video. What's nice is they have the shorter clip videos. That's really nice for sharing on social media, because this one's 2 minutes, but they do break it up into segments. So I do like using that as well. And then this is that same content that I showed earlier of the Word document, just like placed, just broken up essentially. And I maybe took out some words about referring, geared towards referring doctors, but it just is able to give some information. I link to the SVS website for referral resources and for patient resources. I've actually updated it again since I made this. So I think it's even better now. But anyway, I think it's a cool way to use the tools, and I look forward to using them more. Like, I would like to eventually have printable material for patients and for referring physicians, because most of our patients are older and they like having that. It's nice not to start from scratch. I do want to use the email tools for our referring physicians. I'm still working with marketing to update our vascular specialist page. And I do plan on just integrating it, especially as you add more videos into social media posts. So what I really like about this is that it's so simple. It can work on this what I think of as a grassroots level, where you can just it can be just as simple as informing the people the people in your immediate community about what we do. And it's not just about self-promotion, it's about elevating our specialty. So the more that we do it, and more of us who do it in our own communities, the more effective it can be. So I'm really excited about it, and I'm really grateful that we have this for us as a resource.
Kate, are you doing all this yourself, or you have office people help you, or how are you doing this?
Oh, for this? No, I didn't. No, I did this myself, but it's really nice to have trustworthy evidence-based guidelines to be able to show my office staff and my nurse practitioner and patients, obviously. And so it's good to have those references. And I think this is better to have this template for marketing per staff to work off of rather than their cardiologist template that they were using for me. So, but right now I've just been doing it myself.
We had the same issues when they started a new branding campaign. We got lumped under cardiovascular health. And initially for about 3 months, the only way you could find us was to go to cardiology first. It was really frustrating. And then I also like what you've done. If you don't follow her on Twitter, you should. She's really thoughtful, but she has great photography. So she highlights not just herself, but the specialty of vascular surgery. There's some really pretty black and white images of people huddled over an OR table, obviously intent to take care of their patient. And she has a new partner. She highlights him. I think it's, no, I mean, I'm not blowing smoke, but it's a very thoughtful use. It's almost artistic. It's hard to make really good black and white pictures, and some of them are really good. So I think she's been very innovative in using this. I think, well, I don't know if Judith is going to get into that. I think we want to stop for questions along the way, or should we have all the presentations and then?
Well, Joe, in general, I think we'll have the presentations, but there is one question that's come in that is kind of specific to Dr. Bowser about being a hospital employed physician. So we might want to go ahead and take that now. We don't have to go to that screen. I'll just read it off for you. So the question is, have you run into any issues being with self-marketing, being an employed physician? Do you need your employer's marketing team approval or oversight for everything you do, or are you free to market yourself?
No, I don't need their oversight for everything that I do, but as we try to incorporate it into the website, we will obviously need to work with them for that approval.
Most institutions, if you're going to have the institution's name on it, they're going to have to approve it. But I know there's exceptions, but if you're branding yourself and you're not mentioning the institution, but that's a little unusual. The other thing I think that we'll probably get into with the other two presentations, but Dr. Bowser mentioned, is the condition-specific flyers. So right now we have 3. They're aortic aneurysm, diabetic foot ulcer, and chronic limb-threatening ischemia. And the reason we picked those is they all have recent SVS guidelines. So if you print them out, the front page starts with a description of the condition, when and why to refer to a vascular surgeon, and what their role is, all in one page. And if you flip it over, mostly Tom Forbes and I went through the recent guidelines and pulled out things that we thought were specifically important for referring doctors and patients to know, like at what size aneurysm should I be referred? And then, what's the expected course when I get to this size, and so forth, and not every detail. And the same thing we did with diabetic foot ulcer. So the idea is, we talked about this a little before, is you're branding your specialty, but you're also branding yourself, so we can brand each other. We can help, the SVS can help us brand our practices, and we can help brand the SVS. But we thought that was a really good idea to have the guidelines on there, because I think some of the referring docs might actually look at them. And if you use the web version, you can click on the links and get the entire guidelines. So that's another way that individual practitioners can actually help promote the profession and our society. So are there any more questions specific for that, Kim? Or?
No, I think we can move on. Just one thing I was going to say regarding the printable media is that there's stuff called brochure paper, which is slightly heavier stock and got a slight sheen to it, or gloss, and it really prints up much nicer if you do it on brochure paper. Just a tip.
Okay. I don't see Dr. Schütze yet. We're going to go alphabetically. So our next speaker is also active on Twitter and social media. Not only is she an outstanding vascular surgeon, she's chief of vascular surgery at Michigan State. She had to drive home in a snowstorm after doing at least 2 emergencies to get here on time. So multitasking is one of her expertise. She's also an MBA. And she's done a fair amount of work doing this in a different setting. So Dr. Bowser is hospital employed. Dr. Lynn works for a university system. So with that introduction, we'll see what she has to share with us.
Great, thank you. Can everybody see my screen? Yes, okay, great. So Lindsay and I, we're gonna tag team this presentation. We'll get through it, and she's been fantastic. She's my right-hand woman in getting this marketing, and she has a lot of talent and skill and energy in this, so we're so blessed. I'm so blessed and lucky to have her. So I'm in an academic practice. And so it's slightly different, part of the College of Human Medicine in Michigan State. When I started this job 8 months ago, in the pandemic era, COVID, there were two challenges I had to do. When I start a whole brand new practice is how do I introduce myself, Dr. Judith Lynn, as a new vascular surgeon to the community? And it's especially hard because we used to go around to the different offices and you have to shake hands and talk to people. Well, we can't do that now during the COVID pandemic. So I had to think, well, we got to do this all virtually. So, so then the other issue is there are very few vascular surgeons in Lansing, which is actually the state capital of Michigan. We're not in the middle of nowhere, but it may seem like the vascular surgery desert. Because I am the only board certified vascular surgeon in Lansing currently. And I always wonder, like, where are all the vascular surgeons? Well, who's taking care of all these vascular disease? Well, we got the interventional cardiologist who does a lot of peripheral interventions either in their OBLs or in the hospital. We have interventional radiologist that also does a lot of peripherals. So that's what most people are thinking, you know, radiology, cardiology do the vascular. And then there's cardiovascular surgeons that do a lot of the bypasses, the carotid endarterectomies, in addition to the open heart surgery. All the open stuff pretty much goes to the cardiovascular surgeons that are trained. You know, 20, 30 years ago, they used to do all the peripheral vascular stuff in addition to the heart. And then also the foot specialists are really the podiatrists and the orthopedic surgeons. Podiatrists took care of a lot of the foot, the toes, debridements and amputations, and they partner with the radiologist and cardiologist. And then orthopedic surgeon does the major amputations, believe it or not, which is actually very different than my training, where most of it are done by vascular surgeons. And then you have the nephrologist taking care of all the dialysis access. Interventional nephrology does the, you know, they don't do the access creation, that's done by cardiovascular surgeons. And then the nephrologist takes care of the peripheral stuff. And then there's the vein specialists who are every Tom, Dick, and Harry in town does the veins. And then the wound cares are done by plastic and general surgeons. So my challenge is, well, how do I bring everybody together and also say, hey, this is all done by vascular surgeons. We can do it all. So I had to do a SWOT analysis of the MSU vascular surgery, looking at our strengths, weaknesses, opportunities, and threats. And this is what I learned in business school. A little bit more than that, but my MBA degree does a lot of the sort of looking at it from all different angles. And so Lindsay's gonna help me. And I went to Lindsay and say, hey, can you take over and help me with this? And she has done a wonderful job.
Oh, thank you. Just some tips and tricks on when you're coming in, building a new practice. These are things we're looking for from a marketing perspective. Your lists of conditions and treatments. This is helpful for not even for marketing, but to work with your referral coordinator and the call room staff. And these are really useful for marketing points. This helps us update your Google listing for SEO, to raise your profile on Google. And then also, this also helps us analyze what sets us apart and what highlights that we do that's unique to our practice. Other things that's very, very useful to have when you're onboarding or starting practice is high-res photos. Your headshot. Currently still the research is white coat is in advertising is the trusted look still for doctors. But also action shots of you in clinic. So you don't even have to have real patients. We sometimes just use MA staff, front desk staff use the back of their head, but getting just different angles, shots of, looking at x-rays, or we wouldn't look at x-rays, sorry, but ultrasounds and that sort of thing. Also, find a good photographer who is is not squeamish about the OR and can go in. You can do it mock with patients, but if you would like to do it with patients in the shot, you must go to pre-op and get photo consent from the patient. Other things useful is to have a biography ready along with the CV. And then other things that we flesh out once you get here and we start working on the onboarding process is, so since vascular surgery is a brand new division of our department, we're trying to scope out what the vision of that is and get the description of it. It's very going to be helpful for us as we're recruiting right now for more additional vascular surgeons in our department. And then again, the goal of practice, all those things. Also getting social media handles, following your department, following your college, following your healthcare system, and just always cross promoting each other. And then making sure are all the entities represented, health system, hospital, university, college. If you're private practice, you don't have to do any of that. Just it's making sure you have everything well balanced. And so here's some materials that we started off with. On the left here is a short provider bio sheet. So this is kind of when we set out to the community physicians, to the hospital systems, so they can just kind of put it up in the OR, wherever, post it, just kind of get it out there. And then the right is the inside of the brochure that we actually have. We send out with our referral packets, has a little bio, as you can see, has the big bullet points of condition treatments, and then a little bit about the division itself.
So what we did with this was, I was very excited when we have the SVS toolkit for both marketing and the branding. And Lindsay was able to help me with this in terms of trying to put my photos in there and personalize it. And also when we went on the website, we have an MSU surgery website, we were able to promote the SVS town hall with Dr. Kim Hashin and myself last year. So multiple town hall meeting, we were able to tell people to send on this link to attend the meeting. So it's kind of a symbiotic relationship between SVS and MSU surgery and vice versa. We also was able to essentially use this list to educate patients. Lindsay was able to do this for me, where essentially personalize this and to hand it to the patients. We were able to use all these SVS brochures to discuss these vascular conditions with patients and referring physicians. And many of these I picked out here on some of the stuff that we do, and also specifically brand some of the additional things. And so we also, this is going to be quick. We used sort of the Twitter post to look at sort of some of the interesting cases. This one was on type 1B endo leak after EVAR and how we fix things. And kind of part of it is like education, kind of what Dr. Bowser does with hers and Dr. Mills. And we're on the Twitter. I think it's a very useful social media platform for some of these. The other is some cool cases for on LinkedIn, looking at sort of, these happen to be iliacaval thrombectomies. And also some of the more unique stuff that I do with the robotics. I like to post it and get some feedbacks or discussion, if you will, on some of these cases using, this one is for robotic nutcracker. A couple days ago, I did one open with a renal vein transplant, transposition. And so that's kind of like the specialty where patients actually do shop around. They tell me, they go on Facebook, they go on and they see my posts and they see my videos and they say, I want that. And I'm like, whoa, you know, we got to slow down here. So there's a little, but I go back and educate them and sort of, we have a good discussion on sort of make sure that it's appropriate care, of course, but also this is something that sometimes I get referrals from this part. It's part of the personal branding as well. And people appreciate that because a lot of my patients, especially the nutcracker patients, they've already seen 10 different doctors. They will shop around the country. And what I also do now is using telemedicine to sort of discuss with the patients. My last patient came from Ohio. She's already been to 4 different health systems in Ohio. And then and she's a nurse, so she's very well educated. So then she went on all these websites, and then there's apparently a Facebook support group for patients with nutcrackers. So once they get that on that, and it becomes sort of, one thing leads to another. Next thing, she's in my office, or I actually did telemedicine with her. And then she drove 5 hours, and then we actually did venogram on Monday and did the open surgery on Tuesday. And then now she's going home after 2 days. So I think this is, it's something that we can use to sort of promote our practice. We also love using these clinical practice guidelines. I think this is fantastic. And Lindsay helped me with this in terms of doing the Facebook Live, where essentially we are sort of educating the East Lansing community with this webinar. It could be physicians, it could be patients. They can get on the Facebook Live and they can ask questions real time. And if they miss it, what they can do is they can also watch the video. And so this has been really helpful. And we talk about the guidelines and appropriateness, and obviously sort of discuss some of the options for patients. Also, the CLTI is fantastic. We also use those, obviously, guidelines and we are able to also personalize it into our practice. This was our latest one, the Facebook Live. We invite other specialties like Dr. Carl Dunn, who is a podiatrist. And I usually like to add a couple members to discuss this. You can see there's 2,000 members in this community. And so they can feed in anytime. They can watch it live, or obviously then they can ask questions. If not, they can watch the video. Here is Dr. Dunn. He's able to answer a lot of the podiatrists. I think we work very well with podiatry, and Dr. Mill does that as well. And then this is actually Dr. Nick Welly, who is actually a PGY5, and he is going into vascular surgery. He's our aspiring vascular surgeon. So he will be in Tulsa next year. And so we're able to do a lot of these programs, and I think patients enjoy that. So in summary, I think we're able to really leverage SVS branding and marketing toolkit, which I think is fantastic to promote our practice and really vascular surgery as a specialty. And I think a lot of it is, we can enhance this with the social media coverage using LinkedIn, Twitter, Facebook, Instagram. The Instagram I find tend to be younger populations. More my vein patients do Instagram, more the Facebook, the older population use the Facebook, more professional business people use LinkedIn, and Twitter is more for like individual cases. That's kind of how I see how I've been using it to maximize the sort of the coverage and really be creative, have fun, and go digital. So I think these are some of the ideas that we've had. And of course, you're always welcome to follow me. And as well as Lindsay. Great.
So Joe, the texted questions are kind of general right now. It might be best to hold on to them until some of the other speakers have given their presentations. But I did have one question for Judith based on your presentation. How much blood and guts do you put out there in the materials you distribute to your patients?
Yeah, no, I cleaned up the photos, and there's no like patient identifiers, and patient actually tell me they want to see they want to see the pictures. So I showed it to the patients, but you can't tell who it is. Yeah, I try not to avoid a lot of the but they actually enjoy it, believe it or not. I actually ask them, and they usually yes. Every one of them tells me they want to see it, and then they were like, "Wow, this is so cool."
Yep. And yeah, no, they do like it. So, but I tend for like the outside covers not to feature bloods and gores so much, leave it for the inside type pictures. But always what happens, always get a photo consent before getting any sort of photo. If it's in clinic, right there in clinic. If it's in OR in pre-op, I go with the surgeon. I go with Dr. Lynn to pre-op, talk with the patient. They sign off a form. I make sure to really not get any sort of any sort of recognizer, and really trying to get, cool angles in the shots of making sure they're very on Dr. Lynn. She's the feature of the photo. She's the subject. So.
Yeah, that was really well done. I think Dr. Lynn's light years ahead of some of us and some of the stuff she's doing. But I think what it shows you, I think their group would have been successful, but then augmenting what their ideas they have and what their vision is with a toolkit that they can personalize makes a big difference. Not having to recreate the content of what the major conditions are, and I think having the guidelines on there, I think that's really useful. And as what I would envision going forward is those will be updated. Every time we get updated, the committee will take a look at it, and how guidelines are. There's occasionally major changes, and other times there's just minor tweaks. And the ones that apply to patients and referring docs may not actually change that much. But I think the idea that seems to be working so far, and the message we've got so far tonight, is that people can take these tools and use them in slightly different ways. So with that, I think we'll, I don't see any other specific questions unless there are. One question came up about how do you target the audiences for the different social media. And I think Judith actually anticipated that and answered it, but we can get into that later if we have time. But I think one thing to remember always is who is the target of what I'm doing. And then once you get that down is what's the best way to reach that audience, right? Because most patients actually, we get some patients that see Twitter posts, but lots of the older patients, their only social media is Facebook. So for example, when the SVS did a poll about what people know about vascular surgeons, they picked the target audience of people in the age with vascular disease and did it on Facebook, because that's the audience that uses Facebook, right? If you wanted to catch younger people, you'd have to use WhatsApp or Instagram or some other format, because they're not going to be on Facebook.
Yeah.
So anyway,
Exactly.
let's
Joe, there is one question that's come in from President Dahlman, which actually I don't think we should address right now, but I'm going to go ahead and mention it so people can start thinking about it. And when we have everybody's given their presentations, they can answer. But the question is, how do you gauge the effectiveness of your campaign? Do you measure referrals, RVUs, hits on your website, et cetera? So at some point towards the end of this, we'd like to hear from everybody. How do you know it's working? So thanks, Dr. Dahlman, for that. And I'll give it back to you, Joe.
Yeah, that's a good question. And I'm sure we'll get into that. Our third early adopter is William Schutze. I've worked with him a lot. We're in the same state, but we're farther apart than many of you might be who are in different states. But he is part of a big group in Plano, Texas, and it's multidisciplinary. And I suspect at a time there were lots of purely cardiac surgeons, and now they have a big vascular presence. And he's also been the head of the clinical practice committee, but he's worked with us on some of these content pieces. And he's going to tell us a little bit about how he's been able to use that in the Texas Vascular Associates. So Dr. Schutze, take it away.
Well, thank you, Dr. Mills. As I'm sitting here, I'm trying to figure out how I can get a Lindsay. I decided I need a Lindsay because Judith, you guys are light years ahead of where we are. I mean, we're based very ABC down here, but I tell you, Dr. Mills and his team have created some fantastic materials. It's actually very easy to get started with these. And the fact that they're so modifiable, if you don't like what you've initially created, you can change it. So I really think it's just a fantastic tool set to start branding your practice. And I'm looking forward to playing with it a little bit more, seeing what other people are doing, and looking forward to the other materials that'll be developed. Let me go ahead and share my screen and go through some of my slides. The talk, this town hall today is about branding, and there's branding in different levels, right? I mean, there's our personal branding, which several of the panelists have already gone over. You're branding yourself in your community. And as a side effect of that, you hope that the specialty gets some branding. But I think it's important that that our specialty become branded, not just locally, but nationally. I mean, we are the only people that can do everything for our vascular patients. I know I'm speaking to the choir, but we really need to get everybody pitching in, trying to brand themselves locally so we can get a national brand out of this. And so I did some research into branding, and I'm not going to bore everybody with a long talk about branding, but this was kind of informative to me since I don't have an MBA and a background in that, but it was just a little bit interesting. So when I researched what created a successful brand, these were pretty consistently what came up. Of course, build an original story. Dr. Mills and his team has done that, right? Help your audience connect with you. We've got all these materials we can use to do that. Create value. Well, where's the value? Well, the value is the flyers that talk about the guidelines, and there'll be more to come. Know your audience. And of course, there's physicians and patients, which are different audiences that we're trying to connect with. And there's different tools in the branding toolkit for each of these, and you can customize those and use them the way you see fit for that. Social proof was a new entity to me. Social proof is a psychological phenomenon where people conform to the actions of others under the assumption that those actions are reflective of the correct behavior. Just think of it as kind of a herd mentality. And so as we roll out these branding materials, and more of us do this, and more physicians and more patients are identifying vascular surgeons as the correct specialists to see, then that creates kind of a reinforcement for that. So hopefully we'll see that in the years to come. Have backup plans, and I think for our branding campaign, it's more tools that are going to be developed, and then display consistency, and the tools that have been developed do that. So we have everything in place to create a national brand for vascular surgery. I guess I probably should go to presentation view. Would that be better? Let's do that. Okay. And then what is successful branding? This is to Dr. Dahlman's question. Well, I guess there's three measures: brand lift, brand engagement, and brand preference. Well, brand lift is the degree of positive shift in customer awareness and perception of your brand. Who are our customers? Our referring physicians and our patients. So as we see that shift, now I don't know how we measure that. I guess it'll be a great discussion later. Brand engagement, and that's the degree of emotional commitment your customer, think of your patient or your referring physicians, has towards your brand. So as you know, we continue with the branding campaign and we start moving people to thinking of vascular surgeons as the specialty for vascular diseases, then there'll be some emotional commitment with that and some embracement. And then brand preference. And this is the most behavior-oriented of the measures. Brand preference is the ultimate goal of brand-oriented initiatives and the most meaningful brand metric. And it's the degree to which your brand is preferred over competitive alternatives, and we know who those are. So anyway, just a few thoughts about branding. I think the floor has been created to get us moving towards having vascular surgery being a brand. And there'll be, I just have a few comments at the end of my talk to circle back to that. What I'd like to do now is do what the other panelists have done and kind of shown you kind of how I've taken the branding materials and started to use them. And actually a pretty simple way, but it doesn't take a lot of time to get started. So first of all, at Texas Vascular Associates, where I work, we have a clinic EMR that's different than the hospital EMR. So there's had to get those integrated in different ways. And we've also incorporated the email templates, which I'll discuss in a little bit. But I'm going to start with the clinic first. And so with our notes, our EHR notes are that we send out to the referring physicians after the patient's been seen. We have a banner at the bottom, and I'll show you how the banner turned out. That looks just great. I mean, just right at the very bottom where the signature line is, there's a beautiful banner that's right there. It's big. It's got pictures. I mean, it really makes that connection with the referring physician. As you've seen in the current EHR climate now, when everybody's on the same EHR, you know, your picture comes up for the other person that is taking care of the patient to see. And since we're not always on the same EHR, this is a good way to put it back into the old school paper kind of model. What I've done is on my desktop of my workstation, I've got a branding folder, and I've got all my branding materials in that I can have at fingertip access if I need them. And so I've got these guidelines for AAA, CLTI, and DFU that I've pulled out of the branding materials with a nice little statement about the SVS guidelines and how you can link to them. And I can drop those into a note, or I can drop those into a correspondence letter that gets faxed to the referring physician. And that provides value. And as I mentioned when I first opened this talk, I mean, value is one of those things that makes your brand worthy of becoming a brand. And so this is where I look at some of the benefits of having these links and having the guidelines there is we're providing value to the referring physician. And then here's our office banners. And we have almost a 15-member practice, and you can only get three pictures on a slide. And within really an hour, I was able to get our practice logos in. I was able to get the individual provider pictures put in. Kind of just did it in chronological order. I started with the oldest. Here's Dr. John. I put him here in the first branding one, you know, and put some of our older ones, and then just went top to bottom with age. And I've disseminated these to all of my partners. And if they want this to be changed or want to be associated with, or just want 3 of their pictures or something else, we have the ability to do that seamlessly. And then they can start putting these banners in their notes as I have. And again, it was super easy to do, very, very low tech. It took a few tries to get the workflow down and then to find the right pictures that would come out nice. Actually, all of these pictures I was able to take just off our website. I didn't have to go around chasing people to get phones. And it's interesting, you know, as Dr. Bowser mentioned, the white coat. The white coat, as it turns out, is a real important symbol for creating trust in patients. If patients see us in a white coat, for some reason, that really raises their level of confidence and trust. So we have a couple doctors that weren't wearing white coats, but they're just out of luck, I guess. So, and here's an example of my clinic note. This is a fake patient, Tony the Tiger. And this is kind of the bottom and how it looks after the note is about ready to be printed and then faxed or emailed. And here's this beautiful banner right here. I mean, it shows myself and 2 of my better looking partners right there. Has our practice logo. And then since this patient, this pseudo patient was seen for an aneurysm, I dropped in there very easily out of this favorites box here. Just pick this and it stuck it right in there. And I have the same text lines for the CLTI and DFU. And then correspondence can be created out of the EHR we use out of the clinic note. There's set boxes that get transferred over. And so it puts all those in here. And this is one of those that just can get automatically transferred over if you like that. Again, and here's the value that my referring physician will get when he is referred to me, somebody with an aneurysm, somebody with CLTI or DFU. And if I figure after a few letters, you know, they may not go there initially, but one day they're going to get curious. They're going to have a few minutes and they're going to click on that and they're going to go check out the guidelines and see that our society is serious about taking care of vascular patients. And the email templates are great. So when I first went into practice, I won't tell you how long ago it was, but we had fax machines, okay, but we didn't have EHR, thank goodness. So, you know, when we would get these little postcards that said, oh, you know, Dr. So-and-so is launching his internal medicine practice or family medicine practice, you know, and he's open to seeing patients. And that's how we used to do business when we would open up practices. You'd send out flyers. Sometimes you'd go walk around, knock on doors, you know, shake hands. But it was very common to have these postcards sent out. So I had a letter that I had created But it was just a letter, and it would just introduce myself to this person and told them that I was a vascular surgeon and that I took care of these conditions. And I'd be very happy to see a patient for them if they thought that would be helpful. But it was just a black and white letter. And, I'm sure most of the time the letter was read and then tossed aside, although every once in a while, I'd say about 10% of the time I'd get a hit out of it. So now we've got these beautiful letters, right? With the banner up top, my practice logo at the bottom, myself or my partners can put their name in there. They can put their cell phone in there. And this is just one of the letter examples that I brought up. And so when you happen to either run across a physician that's just coming out in practice or somebody that's been in practice and it's a new encounter for you, you can fire this off through email seamlessly. And I think this is going to be a great tool, especially for people that are in their first 10 years of practice. You're really trying to build that foundation for your practice, or if you've recently relocated, when you're just trying to get off the ground in a new community. This is a terrific way to get the word out that's unique and really draws attention to yourself. Again, it also reinforces to folks what vascular surgeons do because it has the conditions that we treat. So over at the hospital, we use Epic, and those of you that use Epic know that there's smart phrases and other EHR systems. I think they're called slick text or other things. And these are just pretty quick links that you can drop into a note that you're creating. And so I've done the same thing with the clinical practice guidelines for these three entities. And again, I've also incorporated the banners as well into the hospital EHR. So here is just a sampling of my smart phrases, and you can see that we've got different choices here. Some just have the guidelines, and some have them with the link. So we've got AAA, CLTI, CLT just with the link. This has the guidelines. This has just with the link. This has the link, and the same thing for DFU. And I've got my advanced practice providers that work on the vascular surgery service line owning this as well. So when they see a consult from me, or they're writing an H&P or a progress note on somebody, and we have other specialists involved, they can drop these in, and then we're providing value because the other people that are taking care of our patients see that the recommendations we're making are based on science and guidelines. This is not just patient has such and such and they need so-and-so because I said they do. We're actually following evidence-based medicine. And again, that provides value. And for the interested colleagues, it's easy to just copy the hyperlink out of the note, go over to a browser, plug it in, and boom, there's the guidelines. So again, we're providing some branding, we're providing some value. And then here's what they look like when it's actually printed out into a note. I just took a screenshot of how it looks. And this is right off the flyer, which just gets right to the meat of it. I mean, this is the important stuff. And this is for CLTI, and this is for diabetic foot ulcer. Oh, sorry about that. Space station's flying over, sorry. And then here's a banner. And I've been doing this since it first came out. I was able to copy this banner and stick it in next to my signature, and every note I sign in Epic. It's got my information, my cell, and it has very prominently displayed that I'm a member of the Society for Vascular Surgery. So people know that, I'm not only am I a vascular surgeon, but that we have a national society. And so there's a couple of things we haven't gotten in that we haven't accomplished yet. We haven't been able to get the flyers incorporated yet, but we will, so that we can start sending the whole flyer out to our referring physicians. Our website is in the process of an overhaul, and although we have an agenda for things we want to do, we've had some hiccups getting the right web designer to help us. But that's a different story. But our plan is to have these patient-facing and physician-facing flyers on our website to be accessed and available. And we'll have the SVS video on there as well. So hopefully in the next few months, we can work through these hiccups, find the right website designer and get that done. We were able to rip out the audio file from the SVS video and link that to our hold music, and that's been tremendous. So back to branding. So you talk about trademarks or brand names and how they become genericized. So what's that mean? Well, think of Coca-Cola and Kleenex. So whenever you need a tissue, it's a Kleenex, right? I need a Kleenex. Well, it may be made by generic or it may be just Bounty or who knows, but it's a Kleenex. Everybody knows what a Kleenex is. It's a facial tissue. Growing up in the South, if you wanted a soda pop or a soft drink, you asked for a Coke. And when you ordered your Coke, the person waiting on you would ask, well, what kind of Coke do you want? Now, if you're from the South, you kind of get that. You might say, well, I want a Sprite or a Dr. Pepper. But that's that genericization in the South. Like in the Midwest, it's a whole different thing because everybody calls it soda pop. But in our world, I mean, we all call warfarin Coumadin. I mean, some people are pretty, right on, but Coumadin and warfarin, those are different names. But Coumadin has been genericized for what is warfarin, even though most of the warfarin is now made by a whole different vendor. Luerlock was initially a trade name, and everybody knows what a Luerlock is, where you can connect your syringe to the needle or other things, but that's been genericized. And even Portacath. I mean, what kind of Portacath did you put in? Well, I put in a Metaport. That's an example of genericized trademark. And I'm thinking, why shouldn't vascular surgeon and vascular surgery eventually become genericized trademarks? I think we can get there if we just all use these tools and use the newer ones as they come out and just keep flooding our consumers, which is our referring physicians and our patients, with these materials. And this is for the boomers that may be on the call. And if there's some younger people that recognize this one, kudos to you. Let's see here. Hopefully it'll play.
It's tough. The toughs get going. Who's with me? Let's go. Come on.
Well, thank you all for your patience and letting me ramble on and on. And I'm happy to take any questions later during the panel discussion. And the good thing about being on this panel is I get to learn as much as or even more than I give.
Thank you, Bill. So, Joe, before we go to Mr. Chapman, who's going to talk to us kind of about the nuts and bolts of how you do all this stuff, there are some, maybe I would say, political type questions that have been texted into the audience Q&A. So we're going to go to Q&A next and ask the panel.
You muted yourself.
You're muted. The dot phrase of 2020, you're still muted.
All right, so we've heard several presentations, and many of them, certainly Judith's, focused mostly on Judith, as did, I think, Catherine's. And the question is, does this create tensions between you and your partners or other competitors in the marketplace that you're dealing with? Dr. Matos wants to know how cardiology reacted to Dr. Bowser's publications or materials. Anybody want to comment on this?
Yeah, everyone has been pretty supportive. I am in a, even though at the hospital there are now 6 other vascular surgeons, 3 of us are hospital employed, and we all support each other. We're not in competition. We're not paid in a way that would promote competition between us. So that doesn't factor in. There was no issue with administration. And again, like cardiology, also hospital employed. At my institution, they are not doing a lot of interventional work. And when they do, we just take a team approach to things. Rarely can they do a lot by themselves, but every hospital is different and every practice is different. I'm pretty fortunate that it's not a toxic environment.
Bill, how did it work? You included a lot of your partners on the materials, but are they included to the full extent that you are and others?
Yeah, I've been taking the lead on this, and there's generational differences, as you know, in interest to this, and I think the biggest benefits to the branding is going to be to my younger partners as they market themselves, and you know, our group is in a growth phase, so we're trying, you know, we're entering new communities, and so these materials are fantastic. So I've kind of mentored them along with the emails, and then with the banners, and then the links, and then I've got two of my younger partners working on the website. So again, yeah, I've been taking the lead, using this as a practice promotion tool, and we haven't really had any conflicts about that. You know, there was some little, I think, some concern about hijacking the audio feed for the mute for the SVS branding. I think some people thought it ought to be all about the practice, and so we came to a middle ground, and half of it's, you know, practice related, and the other half's the audio feed. So, but overall, it's been there hasn't been any conflict. There has been some ennui for my senior partners, as you can imagine, because they're twilighting their career, and their foundation is set. But this is just going to be fantastic for my partners that are in those first 10 years.
One of the common themes of some of these questions relates to how much time and effort does it take on your part to maintain all these platforms? Particularly Dr. Lin, there was some questions about, do you participate in all four, Facebook, LinkedIn, Twitter, and Instagram? And do you have any help doing this, or how does that work?
Yeah, I don't do it during normal hours. I do it, it's a lot. I don't, I answer most of the social media messages, but I don't answer all of them. Sometimes I just don't have the time. I would say I tend to do it more in the, near bedtime hours. I try to do it in the evenings, or if there's a little bit downtime. I don't do it when I'm working during the day. It's too hectic. So I do answer. I'm mostly on Twitter and LinkedIn. But I do, and the Facebook is more for the Facebook Live, and so I use all four of them. And as far as the effectiveness of the campaign, I think that's a great question. A lot of times, I just gauge by sort of where patients got their referrals. They'll tell me, so I know it's more qualitative as opposed to quantitative. Although I know in my previous position, we were able to use the number of hits, but I actually don't have access to it. They were able to know that for every talk that I gave, I actually got like more than 2,000 hits on some of the campaigns. So it's actually really, really effective, more so than if I were to go to a dinner and actually have like 100 people sit around and have a free dinner. They sit around and we chat. That one's not, even though you think, oh, it's great. That one only got me about 10 out of the 100. So maybe like 10 to 20% positive that actually came back to clinic. So I think a lot of them are actually going more online now. So as far as RVUs, whether if I think some of them came from that, it's very hard to say. I would say probably not. I think a lot of it is most people have a word of mouth, and then they see me on some of these virtual platforms, and they come to clinic, and then whether that actually translates into, but it's more of a visit. That's how we look at it. So. And then previously, I do have 7 partners. So what we did was we did it for everybody. I think there were some differences in how we practice. Some want more arterial cases, some want more venous cases. So we actually kind of have a separate format, and I kind of include, and I basically asked my partner, do you want to be included on this? And some would say, no, they don't want to do anything with veins. So then they're not part of that vein brochure. And then even though we're all division of vascular surgery, but there are certain specialties that they subspecialties that they want to focus on. So I think you can do it that way. Right now it's me, myself, and I. So obviously it's promoting the department division section. But yeah, we're getting 2 more partners. I'm getting 2 more partners. So obviously I would promote them as well. I don't want to just be me. I actually want it to be the service.
So Dr. Bowser, did your campaign stir up any ill feelings amongst the cardiologists that they were trying to group you with?
No, not at all. I think it was totally unintentional. It was just like almost lazy because they had just hired a bunch of new cardiologists. And so they were just kind of like fitting me in with that mold. I think it may have also been that we all happened to be women, that they kind of put us together and tried to gear it towards women's health. And as far as their advertising take. But no, we all, believe it or not, we all get along and actually hang out. And so there's no ill will. And it's never, I don't think that the purpose of this is to really put down other specialties. I think that there's a way to coexist and still elevate what you can do. And there's a way to work as a team. I'm in a hospital employed setting, so a lot of the other physicians are also hospital employed. There's not a lot of motivation to compete with each other. We really just focus on patient care. And then it's getting back to, as far as the vascular surgeons who are not hospital employed, well, we have more than enough vascular disease to go around in Delaware. And so there's really no ill will between any of us. We all just share call. Like, it's just no drama.
Does anyone else want to comment on Dr. Dahlman's question?
Yeah, so how do you measure it? So obviously some things are going to be easier. If you recruit a new partner with some expertise in chronic venous disease or TOS, and you're doing almost none of that, it's pretty easy to track referrals and see growth. So we've started working with a thoracic surgeon who does ribs robotically. And we do for venous TOS, we do all the lysis, the venous procedures if balloon angioplasty is necessary, occasional stent after they've been decompressed, but it's all done as a group. And not all of us wanted to be involved in that. So we've tried to market that as a program. But on Twitter, so that's one way to track it, is actual referrals if you're building something completely new. On Twitter, if you're on Twitter, if you go to your profile page, there's this little symbol with 3 dots. And if you hover over it, it says more. And when you click on more, it says analytics. And it actually gives you a monthly summary of how many impressions. That means somebody at least looked at your post. You can tell how many people actually opened it. You can see how many likes there were. If you posted content, like I frequently post SVS guidelines content or articles from JVS, you can see exactly how many people actually opened the article. So for that, you can measure that. Now, if you're trying to grow a practice, the ultimate measurement is going to be increase in practice in whatever area you're marketing. I also think it's strongly important to try to market your group. I think that's the way medicine is going, but it doesn't mean everybody in the group has to do the same thing. So you can kind of divvy up. I think you build the group and you try to make sure that your group is comprehensive, because each one of us is not an expert on every single thing that vascular surgeons do, right? All of us have some interests that are slightly different, but you want your group to be able to cover the whole depth of our specialty. So I think that if you're using it solely to build a practice, you're going to have to look at clinic visits for specific conditions. You're going to have to look at actual productivity as far as procedures.
So Mike, you've been working fairly closely for several years now with Mr. Mike Chapman of Springboard. And I think it might be a good time to turn it over to him to talk us through some of the nuts and bolts, and there may even be ways within that system to help measure the effectiveness of these campaigns. So you want to go ahead and introduce Mr. Chapman for us?
Yeah, Mike Chapman, we met with several people from his group. And the first couple ones, they've had experience in branding before, which none of the members from the SVS really had. So they had to explain branding to us. And then the first couple meetings, you're always wondering, is this going to get anywhere? And it took a while for the members to reach consensus about who are we and what do we want to brand, right? You can't brand something unless you know what you're branding. And then the first couple feedbacks we got from the group from Springboard were okay, but they weren't exactly what we had in mind. And we ended up, I thought, working really well together. I think most people are really happy with the final things that were produced, especially the video and the different tools. And so the reason we currently only have 3 conditions is they take some work. It's not oppressive, but it takes 1 or 2 people to sit down for a week and sort through how to structure it. And that we had to come up with a template. And we wanted to get some feedback. Would people actually use these? Because to make 10 or 15 templates for different conditions and find out the average user had 0 interest in using them would have been a waste of effort. But now that we have pretty good feedback on the first 3, we've got a lineup that we developed with Springboard and in combination with the valuation group, the work that Rick Powell has done. So anyway, Springboard's done great. Mike's kind of taken this personally. So he actually will set up online individual experiences. If you have a person in your group or you have a practice manager you're going to designate to do some of this stuff, he'll set up a time to teach them. I'll let him talk about it. They've been great to work with, and I've really enjoyed the whole group, and especially Mike's dedication. So Mike, why don't you take it off there?
Fantastic, thank you. I will start with a couple thank yous, and while I get my screen up here. You know, I'm always amazed at the skills of the vascular surgeons. You know, now not only when it comes to their taught craft, but when it comes to marketing strategy and their use of the branding tools. So really appreciate hearing from them in terms of how you've been able to take advantage of some of these tools. Want to thank as well Dr. Mills for his leadership, creating the committee that essentially birthed these branding tools and this branding toolkit, along with Angela Taylor, who is the membership marketing and communications manager or director, sorry, at the SVS, has been just invaluable through this process. So this is, as you should see, is the branding toolkit, and then Dr. Bowser gave you a little bit of a preview of it. There are a number of different folders here, and I'm going to take you through the how I do it portion of the program here tonight. So a couple things I'll start with are really things that you should know going forward. So Dr. Schutz mentioned creating a folder and putting your branding materials in a separate folder. Great tip. You know, put your logo in there, put the photos you want to use in there, so everything's in one place. Fantastic. Will save you a lot of time creating these tools. A couple of things in, you know, it's the part of the web page that no one reads because you just want to get to the stuff. But take some time to look through this. One thing you do have here is a quick reference guide, and if you click on it, it will open up just a simple 3-page PDF that I really recommend everyone print out when you get started. It will talk you through in very simple terms how to download things, how to customize the different branding tools, and how to order professionally printed materials if you wish. There's another link here that's a video that essentially is a top to bottom, very similar to what I'm doing here tonight. But if you get stuck and need some advice on how do I do this part of the branding toolkit, you'll find it there. One other thing, I'm going to skip one for now. There's an email here on the toolkit, and if you get stuck, that email comes to me. It comes to one of our account executives. And if you get stuck, just email us and say, whoa, I can't figure out, or I got myself here and I don't think I should be here. How do I get out? Shouldn't be that hard. You shouldn't get stuck, but you may. The last thing, and Dr. Mills mentioned this as well, this link right here will take you to a survey, and it's a standing survey from the SVS, and it does what Dr. Mills said. It is asking you about the value of the tools in the toolkit. It's asking you about what tools would you like to see next. So very, very helpful input for us as we go about building the next set of branding tools. So with those kind of fail safes in mind, I'll take you through some of these. And I'll just go in order. And again, Dr. Bowser showed some of this. So this is the SVS member logo, and you've seen it in a couple of the panelist presentations. So if you want to use it, it is there for you to use as a member of the SVS. So everything's in folders. Click on this folder. It will open up another window. One thing, and this is in the how-to guide, is the whole platform was set up from a printing platform. So there wasn't a way to get rid of quantities and prices, things like that. So some of the things you're going to need to ignore. But if you read the description, you'll kind of learn how to navigate everything. So if I want this logo, I just simply click this link here that says download the SVS member logo. It's going to download onto my computer. I open it up and I can save it on my computer and do whatever I want to with it. I love the idea of putting it in your email signature, putting it on your website someplace, but you know, it's a credential, and as has been mentioned before, it helps brand vascular surgery, and it helps the people that you communicate with understand that you are in fact a member of the SVS. The next thing, and one of the more popular branding tools, is the brand video. This is the same video that you saw before this town hall started, if you logged in a little bit early. Same thing. If you want this video and you want to use it on your website, click this download link here. Again, it will start downloading on your computer. This one takes a little bit of time because it's a little bit bigger file. This is the 2-minute version of the branding video, and I'll talk about the shorter ones in a minute. But this is very appropriate for your website. It's very appropriate if you're doing a Zoom conference with a group of referral sources, for example, to introduce them to what a vascular surgeon is and does, and your approach to care. So again, it's yours to use. It's here for you. And like all of the tools in this toolkit, they're all there for you to download and use as you wish. And there's no cost to any of this unless you order professionally printed versions of some things. So the next thing here in the downloads, and again, Dr. Bowser showed this, is the web copy. Again, it's all referral based, and you'll see the tools that are here now are referral facing tools. So the strategy of going into and branding the vascular surgeons was, first off, we want to solidify those referral relationships, because that's where your patients come from for the most part. You know, we will move into very soon some communications where we're talking and providing patient information. And then the final phase of the branding initiative will be consumer facing, you know, more vascular health and value of your vascular health and a vascular surgeon. But again, all of this is here for you. This is all great referral copy. Again, you download it. It's a Word document. So if I were to open it up, just like Dr. Bowser showed, you can take this copy it, paste it into your website. Use, again, what you want to use. Skip what you don't want to use. You can rewrite some of it if you wish, but it's all there for you to use. And it talks about, as you see on the screen, you know, the value of partnering with you for comprehensive vascular health. It talks through why you should refer to a vascular surgeon, and it talks through who you should refer to a vascular surgeon. So again, valuable information that is simply there for you to go to and use. So those are the different things you can download. There are separate folders here, and I'll show you these next, for primary care physician tools and podiatrist referral tools. So the difference being, you know, what's written in the flyer, for example. So I'll click on the podiatry folder. There's two things here now. One is a single page flyer, and another is a direct mail postcard. So I'll go to the flyer and show you a couple of things. So what we want to do to this flyer is as wonderful as the 3 vascular surgeons are that are featured on this now you're going to want to put your own photos in. So if you scroll down a little farther, you're going to see a big red customize button. So you're going to want to click it. And this gets into the how I do it part. And again, all of these instructions are in that quick reference guide. So again, you'll see, there's no tricks, there's nothing up my sleeve. This is, I have 0 design skills. And I can create these tools in a matter of minutes versus, months that it might take to get the attention of your health systems, marketing department, to get them to create some tools for you. You can go here and build things on your own very, very quickly. So what's here that cannot be changed? So the title and the whole theme of our branding campaign, that surgery is only part of our story, very prominent. And then what is written here is copy that talks to a podiatrist about the value of referring and having that partnership with a vascular surgeon. So what I want to do now is I want to customize this for my practice. So I'm going to click here. All of the things that you're going to fill in are on this left-hand column. So first I want to select a logo. And as Dr. Schutz mentioned, I've created a folder that I call SVS Toolkit on my computer. And we've created this logo, our sort of generic or widget version of a logo called Anytown Vascular Surgeons. Now, if I want to see how this is placed, I can hit the update preview button. And as you saw in Dr. Lynn's presentation and Lindsay's presentation, where they were able to put in the Michigan State logo, it puts it right into the piece, kind of forming that really strong co-brand between your brand and the SVS's brand. Again, to show that partnership and to essentially brand both entities. So now I want to fill in some information about my practice. So I'm going to click on practice name. Now, some of this I've got in here as an autofill because I've done this a few times. Let me find some things here. So it's going to fill in, and many of you may experience the same with autofill. I'm going to go to the website and I'm going to put in my anytownvascular.org. So one thing to note is what you see is what you get here. So, if things aren't capitalized right, or you wanted to put in avenue after your street address, but one of the things I find with the autofill is it misses the dashes or the dots that you might put normally in a phone number. So I'm going to manually have to put those in. So I'm going to hit the update preview again, and I'll show you where this information populates. So you've got the name of the practice here, you've got your phone number, your address, and your website. So now I've got this customized to my practice. Now I want to address the photos. So as I keep scrolling down here on the left side, I see images. I'm going to go left image. I'm going to click the add image button, scroll back up. I'm going to click upload image, and I'm going to find, let's see. I'm going to find this image, and it's going to load into the system. Again, this will take a couple of times to do it, but you'll get it pretty quick. And from then on, everything should be really easy. So you can see how there's an area of the photo that's highlighted. This is the area that's going to be automatically sized to fit into the flyer. So in this particular example, let's say I want to highlight this portion of it right here. So I want to show my providers, but I maybe don't want to show the face of our patient here. So I'm going to click finish cropping. And then I'm going to move on to the middle image. click upload image. I'm going to find my center image. It's going to load that in. And same thing with the highlighted area. So whatever you want to highlight is what's going to be fit in here. If I really wanted to come in closer on this particular surgeon, I could do that. If I wanted to broaden this back out and I wanted to include both, I can drag the little corner that you see like a blue dot, and it'll get to that. So here's my shot that's kind of the classic consultation shot. So I'm going to click finish cropping there, and then I'm going to adjust the right image, and then I'll show you how everything is put into the particular flyer. And again, all the same way I'm doing it on this flyer is the same way you'll do it on all of these different tools. So again, I've got the portion of the photo that's highlighted. If I wanted to focus in on the tech, and I'm sorry, I don't know who these people are, but I don't mean to offend anyone. But let's say I want to focus in here and kind of show what's going on with the patient and our vascular surgeon. So I'm going to finish cropping there, and I'm going to hit update preview again. It will cycle through. Sometimes this takes a few seconds, sometimes a few more seconds to load into the system. But what you'll see is how now I've been able to customize with 3 different photos from a particular practice, this particular flyer for podiatrists. So next question, what do I do with this? So there's 3 things you can do with it. One thing you could do is save it for later. So let's say you weren't quite sure, or let's say you were doing this for someone else and you needed to get their approval, but they're gone for the day. You can click the save for later button. And then when you go back into the toolkit, there's a saved items in the top navigation that you'll find it. One caution is this saves it for about 30 days. It doesn't save it forever. So this is not where you store things. This is where you, as it says, save it for later. Another thing you can do is you can order professionally printed materials. So if you wanted to order, let's say, you really didn't either want to go through the hassle, you didn't have, let's say, a hospital print shop or a relationship with a printer already, and you were going to have to run out to FedEx office or Kinko's or whatever everybody's called these days and do this yourself. One thing that you could do is click on the finish editing button. It will take you through a series of steps where you can order professionally printed versions of this flyer online from the printing partner of SVS. So we know it's a great printer. We actually use them not just with SVS, but with a number of our healthcare clients. And a box will show up on your doorstep, in a week or 2 weeks with 100 or 200 or whatever quantity of these that you want to order. So it's an easy way to get this done without having to go through a whole lot of hassle. The thing that many people and most people will do is they'll want to download it. So this little icon here, again, it's in the instructions, it's in the quick reference guide, is where you download this proof. So I click that, I click download proof, and then if you see at the bottom of my screen, it has now downloaded this PDF onto my computer. So I have this PDF, I can save it on my computer, and I can email it to referral sources. In this case, the content is geared towards podiatrists. So I could email this to podiatrists to let them know the value of partnering with a vascular surgeon. I could take this download and print this in my office on my office printer or at a different print shop. I could take this flyer and put it on my website as something that a visitor to the website could download. So there's a lot of things you could do with this once you have created this, but the whole idea here is that you're able to create, again, materials that are customized to your practice in a matter of minutes on your own, or if you have a Lindsay with a marketing manager that can help you through it. But it's very, very simple and easy to use. So those are that's the podiatry and flyer. The rest of the tools in the podiatry and the primary care physician folders are very similar. There's in addition to the postcard, if I go to the primary care physician folder, there's a 4-page brochure, and I think this was in Dr. Lynn's presentation. It's a 4-page brochure. This is appropriate really for all audiences, referral audiences, I should say, as the name, it's a referral guide for your patients with vascular disease. 4 pages, again, you can customize the photos on the back side of this brochure. You can put in your practice logo, practice information. This one even allows you to put in names of the surgeons in your practice. So a number of tools that, again, you could print this, you could download a PDF and email this to someone, makes it really easy. So these are some flyers and other materials that are geared for specific audiences. What Dr. Mills was talking about and what has become, one of the things that everyone seems to want more of are these condition flyers. And they come in 2 flavors, so to speak. So there are the 3 that we've done that are all customizable. These you can put, again, your practice logo on the back, your practice information on the back. But for those who have very, very strict brand rules within your organization, let's say, you do work for one of the places that says, look, you can't put our logo on anything that we don't produce in-house through our marketing department. What we have found that many or most of these same organizations will allow you to use something from your professional society, not just you as a vascular surgeon, but other physicians that are part of the organization. So these particular flyers are exactly the same as the ones above, but they're just SVS branded. So, you don't necessarily have the opportunity to customize them, but certainly it's very valuable information. And if you went to one of these, for example, the DFU flyer, it's a simple download. Just click the download button. You'll download this flyer onto your computer. And again, you can email it to referral sources, etc. So to take you through real quick, and I'll just show you the back side of this, because again, the customizing is all the same on all of these. So this is a flyer for AAA. And again, as Dr. Mills said, and I think Dr. Schutz showed as well, it talks about the condition. It talks about when to refer, and it talks about why you should refer to a vascular surgeon. That's the first page. And that's a page that's set and cannot be customized or changed. If I click the customize button, I'll take you to the back page of this. And it's the page that has a very abbreviated version of the guidelines. So I'm going to click here and go to page 2. So this has the very abbreviated version of the guidelines. When you download this as a PDF, this link here is actually a live link, and it will take you to the full clinical guidelines on the SVS website.
Did he freeze?
Have we lost Mr. Chapman?
It looks like he froze.
I thought it was my internet that froze.
So I'll tell
Everybody
you
else
what,
is
I
live.
think he'll probably pop back on in a second. There is a quick question we can answer. We don't have to go to that screen right now. I can just read it in the meanwhile. And that is this video going to be available on the SVS website so I can show it to my partners? I'm not sure exactly what video you're talking about. If the question is about the 2 lead-in videos, at the beginning of this town hall. Those are available on the SVS website now. And if you're talking about this town hall itself, it will be edited and available on the website probably within a week or so. So that answers that question. And then did Mike make it back on?
Not yet.
Maybe his line froze. It's cold up there in Chicago, isn't it?
Okay. Well, Joe, there's a couple of questions that have come in. Angela Taylor, who you know quite well, has done outstanding work at the SVS on this project with you, has fed in a couple of questions that we know people ought to be asking about. So one is, these are kind of nuts and bolts questions for you, Joe. Where on the SVS website do you go to access this branding toolkit? And then the next question is, what is the timeline for patient and consumer facing tools? You want to field those, and we'll see if Mike makes it.
Yeah, I can start. So if you go to the website's been updated and improved, and it's under the for members section, but you could go to the branding toolkit. It's really, this actually is pretty easy. So even though I was involved in it, I only recently started to play with it, and I sat down and we collected pictures and we put this stuff together. And with my office manager, we made a bunch of them in a very short time. So they're really user friendly. The next thing we're working on now, which we hope to get out within 3 months, it might take a little bit longer, but certainly before the VAM, is the rest of the condition flyers. So the ones we've marked are carotid disease, dialysis access, other aortic diseases, probably thoracic outlet syndrome. We're going to focus on things that most of us do, and also things that have recent guidelines, because it ties in really well with the template. As far as patient facing, that'll probably be rolled out towards the end of that process with the more condition specific flyers. Well, William Schutze had a good comment. So the couple things, when you do this, what you should do is make a folder. It's kind of like preparing a manuscript. So you get all your stuff together and the parts, you know, they're going to ask for it. So if you have, kind of look at the material first and see where images would go and so forth. And if you have a logo, get all that stuff ready in a folder. So when it's time to change the pictures on the part that's customizable, we can do that. The other question William asked, which I think, hey, Mike, welcome back. So Mike, there's always a problem. So this came up, this is something for discussion. We actually are trying really hard to brand our whole group. So we have a whole group picture that has everybody in it. And so there's a feature on that when you pick a photo and want to put it up, it tells you whether or not the quality is adequate and whether it's going to fit. So can you tell us a little bit about that? And then I think I'd like to gauge some interest, since we have a lot of participants. If there's an interest in having group photos, it may require some adjustment in our formatting, because right now that's difficult to do. So if you could kind of address the feature that allows you to assess your photo, and then the other question related to larger photos or wider photos.
Sure. To answer the question about the photos, I don't know that you get it as often in the photos. I know it comes up in the logo for sure. What it's essentially alerting you to is you may have selected a photo that just is not high resolution enough for something that's professionally printed. Now, a couple of things that I would suggest is, if what you're customizing is going to be on your website, don't worry about it. Resolution on a website is considerably less than the resolution you need to actually print something for someone. But as you select the logo or you select a photo, it is going to tell you whether, and I don't know that I've got one on here that's lower resolution. If that's going to tell me anything. But it essentially is your guide, and where this comes up a lot. And let me just finish this one. So this one does tell me it's a high resolution image or a high quality image. Where you run into trouble is if you grab photos off a website. Just like don't worry about using a low resolution photo if you're putting it on your website. If you grab something off a website and put it in, it's probably a low resolution image. So I don't know if Dr. Schutz, if you ran into that where you grab the different partners off your website to put them into those different flyers. But what you really should do at that case is find a different photo. If it's something you've taken even with a smartphone, it will be high resolution enough. I wouldn't worry about it unless you're grabbing something off a website.
Yeah, that's the biggest thing. If you grab it off a website, there's highly variable resolution. And a lot of them, they look okay when you're looking at the small image. And when you put them in here, they're just inadequate resolution.
Yeah.
But
Yeah,
most
Mike,
of you won't be doing that, I don't think.
Yeah, Mike, that was my experience. But what I liked about it was it told me pretty quickly it was low resolution. And it just cut several steps out so I could go back and pick a different one. I just thought it was a great feature that you get immediate feedback before you've gone the extra few steps to create, that embedding, and then it comes up and it's all fuzzy,
Right. And it's actually a nice offshoot of this being a printing platform. If printers are going to be gnarly about anything, it's going to be photo quality. And, they don't want to have you order 200 of a particular brochure or a flyer, deliver them to your office to have you open up the box and go, I'm fuzzy here. So that's why that warning is there. Just to help you not put something in that you didn't intend, or not have it turn out as you wouldn't wish. So sorry about freezing and disappearing there on you. I was talking through the flyers. I think we've kind of gone through those pretty well.
So Mike, if you use these, if you have them on your website and there's a link, I believe some of the information actually is a hot link, right? So for the guidelines, for example, if you actually get a physician that's interested, they could theoretically click on the link. Is there a way we're going to be able to track that activity? So we'll be able to track how many people have tried to customize the flyers, correct?
Yes, we can track activity to this toolkit page or to the toolkit site.
Okay.
We can't get super granular in terms of, knowing exactly how many people downloaded flyers or who they were. But we can understand traffic on this website because it is essentially a different website. And we can understand how long people are spending on it, so we know if people just come and look for 2 seconds and leave.
Yeah, that partially answered Dr. Dahlman's question earlier. I mean, one measure of the success of this will be, do our members use it? And we can track that. So if we see initial enthusiasm that's significantly dampened, it means we either need to do another branding forum or figure out with a focus group, or we aim in the wrong direction, we need to redirect. But at least the initial momentum's been really good, and I really want to maintain that. This is not, when we started this, we thought it was going to be a 3 to 5 year project. This is not something that goes quickly. Right. And so, but we do want people to use it, and we do want your feedback.
Yeah, so this is the hot link. As you download this as a PDF, this will be a hot link that will go to the SVS site. And on Angela's team, they can track activity to that page, that guidelines page. So we can tell a couple of things. We can tell how many SVS members have created logins and have been to this page. And we actually do know who you are in that case. We can track how many visits to this toolkit, and we can track how many clicks we're getting to the different guidelines pages on the SVS website, to the podiatry page on the website, and there's a separate referral page on the SVS website as well. So we can track all of those things. So I want to show you a couple of things here real quick, and I won't go into tremendous detail on these, but I do want to get to the social media. So a couple have mentioned email communications. Again, we're giving you the tools you need, and use what, again, helps you, and you don't have to use everything exactly as is. But there's a couple of things here, and I've seen this from a few of you. There are some header images. So whether you want to create your own email template, or whether you use an email service, a constant contact or something like that, it provides you with an image that you can use for that purpose. It talks about today's vascular surgeon. So this is the header that goes across the top. You can customize these photos and put your own photos in there. The complement to that is then the footer. So after your email text, you can put in this particular footer that has the member of the Society for Vascular Surgery logo on it. And the surgery is only part of our story theme line or tagline. What goes in between, you might ask? That is the email copy. So again, it's simply a Word document, and you simply download it by clicking the download sample email copy button. There is one sample email that is for primary care physicians. There's another one that's more geared towards podiatrists. It's a Word document. Use what you want to use, change what you want to change, but at least this gets you started, is the whole idea here. So, you know, what we've attempted to create here is a system where you can create your own professional emails using the different elements of the email portion of the toolkit. What I want to spend a little bit of time, though, on is social media. It's something that we have found many of the SVS members are very passionate about, very active on, and I want to show you the tools that we've created. So we'll click on the social media ads folder, and an important distinction. Now, while all of the things that we've created can be posts, you can post something on Facebook or Twitter or Doximity. These are the 3 channels we have now. We will expand into LinkedIn tools. We will expand into Instagram, and who knows what the next platform is. But again, our audiences are pretty much defined this way. If you want to reach consumers, you're on Facebook. If you want to reach your counterparts, referral sources, other physicians, we have found that you can very successfully reach them using Twitter. And then obviously Doximity is a tool, essentially the LinkedIn for doctors, where you can post things and get your information out to other physicians. The other thing that's in this folder, because they're very appropriate for social media, are video segments. So what we've been able to do, or what we've done for you, is we've broken up that 2-minute brand video into 5 chunks. And each of them are between, the shortest one's 19 seconds, the longest one is 30 seconds. But we've got one that's on the vascular health team, another that talks about comprehensive vascular care, another one talks about clinical breakthroughs, patient-centered care, and today's vascular surgeon. So again, these have been really popular on social media, and they're simple downloads. If you want to download this first one, you just click the download button. It'll start downloading this onto your computer. You save it. You can put it right into a Twitter tweet or a Twitter ad. There's also sample social media post copy that you can get. So again, you can click on this. It'll download a Word document, and it's for each of these videos. So for video 1, we have a tweet, and for video 2, here's a tweet. For video 3, there's a tweet. Certainly they would be appropriate for the other social media channels, but we wrote them to Twitter because Twitter has some funny rules about character space, etc. So that's where you find these video segments. Now let's just kind of dive into the Twitter folder. If I click on the Twitter folder, and same with the Facebook folder, and same with other folders that we'll create, first and foremost, there's a how-to guide. So I think this is maybe 4 pages, including the cover, but it's how to post and how to promote a Twitter tweet. And it takes you through step by step. I don't think any of you probably need to understand how to tweet, but how do you create a Twitter ad? And that's what you really want to know. What you can do with the tools in this toolkit is you could create ads on Twitter, and you can target them to certain audiences. So let's say, for example, I wanted to put out a photo. Now we've got one of the photos from our photo shoot. This one's at Loyola here in Chicago. And you want to put your own photo in. Same thing we did before. You go to the customize button, you select your photo. The neat thing about it is this little swoosh with the member logo is going to stay on your photo. So now you've put your photo into this. The next thing you've got, to kind of build it all, is Twitter copy. So there are 3 pieces of Twitter copy that are more appropriate for primary care physicians, and there are 2 that are more appropriate for podiatrists. So again, not that you're unable to write a tweet, but we help you get started so that there's copy that goes with these tweets. And then these are the same types of images you've seen on the brochures and the flyers and everything. And of course, you can update and put your own photos in here. The neat thing, and I want to talk to this for just a minute, is when you do social media advertising, a couple of things. 1, you can target your audience. 2, it's exceptionally inexpensive. To give you an idea, for most of you in your practices, now this may not, if you're in a very, very densely populated area, if you're in LA, if you're in New York City, even Chicago, but a practice in Chicago, because that's where we have more experience, might spend $25 a day doing Twitter ads. So, you can put out an ad for, 10 days, 20 days, a month, or whatever you want, and it's not going to cost a whole lot of money. But the thing you can do is target it. So you can select for this Twitter ad, I want this Twitter ad to be shown in these zip codes. So you pick the particular zip codes you want your ad to show in. You can click and select interests. So you can put in keywords. So you might put in arteries or diabetes or cholesterol, or you might put in limb salvage, or vascular health, or non-healing wounds, so you can put in different keywords. So it'll find its audience that way. The other thing you can do is you can click and put in a lookalike audience. So if you wanted to advertise essentially through Twitter to podiatrists, you could target followers of the APMA, the Podiatry National Association. So you know that within these zip codes, followers of APMA probably are podiatrists. And if you add on top of that some keywords that they might be most interested in as they're on Twitter, your ad is going to just show up in their news feed on Twitter, just like the other posts and other stories are going to show up on their news feed. So again, all of this is in this how-to guide, but we have had tremendous success advertising on Twitter. And again, it's not prohibitively expensive, and something I really think everyone should take a look at in terms of, this is a way to get my message out to the right audience in a very targeted and very efficient way. The last thing, and I won't really go into them too much, are banner ads. So you know how you're on a website and you see a banner ad, you can create those. Again, there's a how-to guide. So how do I set up a Google digital display ad campaign? It'll walk you through how to do it. And then you can customize the different ads that happen to be in it. So again, obviously you can put in your own photos, you can put in your own logo, and now you've created an ad that's going to show up on a page of content that's related to venous disease or related to, foot wounds or something like that. So you're, again, targeting it to the audience that you want to speak to. So with that, I've taken you through the kit. Again, everything here is referral facing at this point in time. We are working on some patient education pieces. Actually, if you go to the SVS's website, the SVS Foundation has created some absolutely fantastic patient education tools that talk about different vascular conditions and different vascular diseases. They're actually even both in English and Spanish, and they're available for you to download and use today. So I would highly recommend checking those out. Those may be things that we'll be adding to this toolkit. So we may see a folder here soon that says, patient education materials. We've heard a lot of things from other members about additional tools that we should be building. But again, as I said earlier, and Dr. Mills has said, we want you to go to this survey and tell us the types of tools that you want after you've gone in and started using the toolkit. So with that, I will stop talking and open it back up.
Well, thank you, Mike, for that comprehensive overview. This is a really very impressive toolkit that you guys have put together. Joe, you and your team should be congratulated for that. I think there's just tremendous opportunities there. I do see from the Zoom chat that Lindsay has volunteered to talk to us a little bit about boosted advertising posts. Lindsay, you want to throw in a couple of cents on that?
Yeah, Mike covered a lot there on Twitter. Most of that also applies though on, you can do boosted posts on Facebook, you can do boosted posts on Instagram, you also can do boosted posts on Google from your Google listing. So those are all different ways that you can use your boosted post.
All right, great. Any other panelists want to weigh in on anything before we close at the top of the hour here? And Mike, could you unshare your screen?
Sorry, yes.
You froze, Kim. You're muted now, Kim.
Finally got to it. All right, very good.
I can do something really quick and we can give Kim a chance. Let me see if it'll let me. I can't share.
As
right
always,
now.
you've been given the avenues to ask questions. Joe, you want to wrap it up?
Yeah, I think we really want people to use this. I'm really encouraged by, we tried to share with you 3 different people tonight from different parts of the country with different types of practices. And you can already see just with early users how we can individualize it. And there's things that each of them has shown that I hadn't even thought of, even though I've been involved in developing these. And so I think, I just played with them on Monday with my office manager, and it comes out really good. If you've got some photos already of your group, like we already had updated our website not too long ago, so I had some really good photos for that. You can use those. One question I had for Mike. So if you type in all your practice information for one flyer and you're going to do a different flyer, do you have to repeat that or does it save it?
It won't save it in the system. What typically will save is, how you maybe saw where mine sort of auto-filled. I think that's a Google thing on my computer.
Okay. That would be a nice thing if we could work that out in the future. So let's say you start with a couple things and then you want to keep working on it, not to have to do that repeatedly. But some of the programs, depending on what browser you're using, have autofill anyway. So.
Mm-hmm. Yeah, and Joe, I would suggest one thing. A lot of practices have multiple locations. At this point, you're kind of locked into picking one side of service. So if there's an ability to expand the different locations.
Yeah, we've discussed that. So one way is on one folder is to list all your practice sites, and then to print up individual ones for if you have maybe you have offices in 5 places and you operate at 3 hospitals. Mm-hmm. We haven't figured out yet. We can work on that, but it becomes a space issue. So if you really had, you're a big group with 7 clinic sites and 3 or 4 hospitals, there's a certain amount of real estate on your page. Some of that may be hard to work around, but we can try to be creative.
Actually, Dr. Schutz, we were playing around with that on one of the consultations we did about a week ago. Same thing came up, and it will ask you in that left column to fill in all of the information. So you're filling in your practice address, city, state, zip, phone number, web address. Doesn't mean that's exactly what has to go into those boxes. So what we were able to do is we took, I think it was the street address box, and we just played around with it. And we put in the 3 cities that practice was in. So, city 1, a couple of spaces, city 2, a couple spaces, city 3, a couple spaces. And then we didn't fill anything in for in the toolkit where it asks us for the city, state, and zip. And when we looked at it, it put it right in, like where the street address would go, it put in the 3 cities that they had practices in. So there are some ways you can get creative with it. We just are kind of locked in, like Dr. Mills said, to the certain real estate on the flyers, but you can put some other things in the boxes if it helps.
And this, can I share my screen real quick? Let me just show you this. We just did this Monday, so it's not anything final. I don't know if I can make that bigger. Let me make it full screen. Can you see that? Well, at the bottom here, we're going to finalize it. It has all the people in our group. It has our Save the Extremity program. It has a member for vascular surgery. It has our office address, and it has a link for the website. And that's a lot of information you can put in there. We're going to play with this a little bit, but it just shows you that you can. This took just a few minutes, and we haven't even sat down to try to. I'm going to get input from all the group members and share it with some of the other surgeons, but it doesn't take a lot of expertise to work through.
Well, Joe, we've seen some exciting examples of how people are putting the toolkit to use. I think there's great opportunities here, and it's great to know that there are other things in development still. This is a work in progress. Lots of opportunities for us and our members. I'll also remind everybody, as Dr. Mills said, that you'll be hearing more about a contest that you can enter to show us exactly what you've been able to do that's unique and different. And I'll remind everybody that when we sign off here in a few seconds, if you stay logged in, you'll see the branding video in its entirety, as well as another SVS promotional video that are available for you to download and use as well if you didn't catch them at the front end of the show. So once again, I'd like to thank everybody for their hard work and efforts. This is a huge accomplishment for the Society for Vascular Surgery. In all my years in leadership of the Society, this is the thing that members clamor for most, is branding of our specialty. And I think we've got a great head start on that. So thanks, Joe, and your committee and all the panel members. And we'll see you on our next town hall. Thank you.
Great.
Millions of adults in the U.S. are diagnosed with vascular disease. And it's no wonder. With over 60,000 miles of intricate arteries and veins throughout the human body, there are bound to be complications due to blockages, weakening of the blood vessel wall, and other issues impacting the circulatory system. With an aging population and the growing incidence of risk factors such as diabetes, high blood pressure, obesity, smoking, and the disproportionate incidence of vascular disease in our minority populations, the management of vascular health is becoming a key focus among today's healthcare leaders and providers. As with any medical disease or condition, it takes an entire team of dedicated professionals to find new ways to efficiently diagnose and treat patients, as well as to improve their long-term care. In vascular health, the leader of the team is today's vascular surgeon. Only vascular surgeons dedicate their entire training and practice to address the full spectrum of vascular health, as well as provide comprehensive care that includes preventive, medical, surgical, and minimally invasive solutions. Through ongoing education and research, as well as pioneering new techniques, vascular surgeons are on the leading edge of clinical breakthroughs that are transforming vascular health. As part of their comprehensive approach, vascular surgeons partner with other healthcare professionals to provide quality care tailored to each patient. This patient-centered model is vital to help all physicians manage vascular health in at-risk populations and promote healthier lifestyles in the future. Vascular surgeons are involved in every part of the disease process, from making the diagnosis to the management of disease. Vascular surgeons are comprehensive leaders in vascular health. Today's vascular surgeons are creating a new chapter in the vascular health story with improved patient care, better outcomes, collaboration, and leadership. Surgery is only part of our story.